Good afternoon, guys. We are discussing for discussion A. We are discussing Utah's approach to aging with care and connection. So I'll go through their program for seniors this afternoon for A. So please join me for presentation A. Okay, here we go. Here's a summary of the key points from the article, Utah's Approach to Aging with Care and Connection. Utah's aging population. Although Utah has the youngest population in the U.S., its senior population is expected to more than double by 2060. Reaching 25% of residents. Currently, only 12.2 of Utah's are aged 65 or older. Aging with a Wise Purpose Symposium. A major symposium was held in Salt Lake City to address aging related issues. Wise standards for wealth, independence, security, and engagement. Hosted by Governor Spencer J. Cox. The event brought together experts in health care, economics, and public policy. Key themes discussed: health and isolation. Aging often brings emotional challenges like loneliness and loss. Economic concerns. Seniors may struggle to meet basic needs. Aging in place. Emphasis on helping older adults remain in their homes and communities. Fraud prevention. Protecting seniors from scams and financial exploitation. Community and connection. Salt Lake County Mayor Jenny Wilson emphasized that aging challenges require collective action. Not just government or nonprofit solutions. Governor Cox highlighted the health risks of social isolation, comparing its impact to smoking 15 cigarettes a day. The overacting message: Utah is proactively preparing for its aging population by fostering community care, connection, and thoughtful policies. Would you like a deeper dive into any of the topics they covered? Utah's senior population faces a range of challenges as the state prepares for a demographic shift, where here are here are the key issues highlighted in the article. Emotional and social challenges. Isolation and loneliness. Many older adults experience emotional impacts, such as a loss of loved ones, and reduced social interaction, lack of social connection. Governor Cox noted the absence of meaningful relationships can be harmful, as smoking 15 cigarettes a day, economic pressures, meeting basic needs. Seniors often struggle with financial stability, making it difficult to afford essentials like housing, food, and health care. Fraud and exploitation. Older adults are frequently targeted by scams, requiring stronger protections and awareness efforts. Aging in place. Desire to remain at home. Many seniors wish to stay in their homes and communities, but may lack the resources to or support systems to do so safely. Healthcare access. Managing chronic conditions. As people age, they often face increasing health issues that require consistent and affordable care. Navigating the system. Understanding and addressing health services can be overwhelming for older adults. These challenges are compounded by Utah's rapidly growing senior population, which is expected to more than double by 2060. The state is working to address these issues. Through community engagement, policy reform, and events like Aging with a Wise Purpose Symposium. Would you like ideas on how communities or individuals can help support aging populations? Utah is taking a proactive approach to support its aging population through a mix of policy initiatives and community driven strategies. Here are the key policies and efforts being implemented. Government led initiatives. Aging with a Wise Purpose Symposium, hosted by Governor Spencer J. Cox. Event brought together leaders in healthcare, economics, and public policy to address senior related challenges. Wise standards for wealth and independence, insecurity, and engagement, which which guides the state's aging uh, strategically or strategy. focus on aging in place. Policies are being shaped to help seniors remain in their homes and communities safely, reducing the need for institutional care. Fraud prevention measures. The state is working to protect older adults from scams and financial exploitation, a growing concern as the population ages. Health and social connection, combining, combating, combating isolation, recognizing the health risks of loneliness. Utah is prioritizing programs that foster social connection. Governor Cox cited research. Equating the health impact of isolation to smoking 15 cigarettes a day. Community engagement. Local leaders like Salt Lake County Mayor Jenny Wilson emphasize that aging challenges require collective action, not just government solutions, but also community and nonprofit involvement. Economic and emotional support, addressing basic needs. Policies are being developed to ensure seniors can meet essential needs like housing, food, and medical care, especially as economic pressures mount with age. Mental health awareness, emotional impacts such as grief and loss are being acknowledged with efforts to uh, integrate mental health support into senior services. These efforts reflect Utah's commitment to aging with dignity, care, and connection. If you're curious about how other states compare, want ideas, local advocacy, I'd be happy to explore that with you. Absolutely, Utah is laying the groundwork for several promising aging initiatives that aim to support seniors with care, connection, and dignity. Here are some standout examples from the article. Aging with a Wise Purpose Symposium, hosted by Governor Spencer J. Cox. This event brought together experts in health, care, economics, and public policy. WISE standards for wealth, independence, security, and engagement, which serves as a framework for aging related strategies. The symposium focused on key issues like aging in place, fraud prevention, and social isolation to support for aging in place. Utah is developing policies to help seniors remain in their homes and communities rather than moving into institutional care. This includes improving access to home based services and community support networks, community Salt Lake County Mayor Jenny Wilson emphasized that aging challenges require collective action, not just from government, but also from nonprofits, families, and neighborhoods. This approach encourages culture of volunteerism and compassion to support older adults. Combating social isolation. Governor Cox highlighted the health risks of loneliness, citing research that uh, equates its impact to smoking 15 cigarettes a day. Utah is prioritizing programs that foster social connection, such as community centers, senior clubs, and intergenerational activities. These initiatives reflect a thoughtful and inclusive approach to aging, one that values independence and connection and dignity. If you're curious about how other states or countries are tracking similar issues, I'd be happy to explore that next. These aging initiatives in Utah have a ripple effect that extends far beyond the senior population. Here's how they positively impact communities as a whole. Strengthening social fabric, fostering connection, programs that combat isolation, encourage intergenerational relationships, volunteerism, and community engagement. Shared responsibility. As Salt Lake County Mayor Jenny Wilson emphasized, aging challenges are not just for government to solve. They invite neighbors, nonprofits, and families to work together. Enhancing community stability, aging in place, supporting seniors to remain in their homes helps maintain neighborhood community and reduces strain on institutional care systems. Local economic benefits. Seniors who stay active and engaged contribute to local economies through volunteering, caregiving, and spending, uh, promoting public health, mental and emotional well-being, reducing loneliness, and supporting mental health, improves overall community health outcomes. Preventative care focus. Initiatives that prioritize wellness and early intervention reduce long-term health care costs and burdens. Building resilience, fraud prevention, educating and protecting seniors from scams strengthens financial literacy and security for all age groups. Emergency preparedness. Communities become more resilient when they plan for the needs of vulnerable populations, including older adults. In essence, these initiatives create a more compassionate, connected, and forward thinking society where aging is not a burden but a shared journey. Want to explore how similar models are working in other states or countries? I've got plenty of examples. Okay, guys, so that is A for you. I will be back on shortly with B as soon as I take a small break myself, and I will be back on with B shortly. For now, Gator Wellness, take care, folks.